So with the faculty we do have on the line and in the room, we wanted to do a round robin of some questions from students. So we'll start with Dr. Garcia, and the question is, what are you involved with outside of campus? Tell us about your current community engagement.
So I'm involved in a lot of things outside of campus. I'm a health commissioner for the Anchorage municipality. I also am part of the group here on campus called the Alaska Arts Partnership Organizers, and we're part of the Center for Community Engagement and Learning, and our main focus is on reaching out to Asian and Pacific Islander communities here in Alaska. We do research, but we also hold events here on campus. Specifically, during October, we celebrate the Filipino American History Month. Other activities that I engage in outside of the university is working with the Anchorage Youth Development Council, the Anchorage School-Based Health Center, and Anchorage Injury and Prevention Center. So that's me in a nutshell in terms of my involvement outside.
All right, thanks, Dr. Garcia. How about Dr. Johnson?
Yes, hi everyone. I am also, I think it's always been a strength of our graduate program that the faculty and students are very involved outside of campus too. You already heard about the Alaska Health Summit, which is an Alaska Public Health Association initiative. I'm active on the board there. I'm the current president. And in addition to pre and post opportunity at the Health Summit, there's also potential opportunities for you to submit student posters or proposals, or to be a tech volunteer and help with some of the logistics. So if you're interested in being involved with the Alaska Health Summit, I encourage you to notice those notices. I'm also pretty active in a group called the Alaska Health Literacy Collaborative, which is really a collaboration primarily with the Alaska Literacy Program, but also with Providence and YWCA and the Muni and others. And this is a project where we've been involved for a little over 10 years, primarily working with adult learners of English who are new to the community, primarily immigrants and refugees. And we have a program there of training peer language and leader navigators from each of these cultural groups to access and use reliable health information in their own communities. So that's kind of a fun group to be involved with. We have a current opportunity for students. We have an internship. We've had an MPH student involved with our group for almost 10 years each year. And that intern has the opportunity to work with both the logistics and the evaluation of the collaborative activities. So if anyone's interested in that, let me know. I'm a new board member of the Alaska Blood Bank, and so I'm learning more about that group. And I noticed just in today's Anchorage Press that the Pirate Pub Crawl, which is coming up September 15th, is actually a benefit for the Blood Bank of Alaska. So if you were ever interested in dressing up like a pirate and visiting a few of our downtown establishments for a good cause, that's an opportunity on Saturday, September 15th. And I think the other, very good, Eric. Yes, to all. Yes, for a good cause. And I guess the other thing I would mention is that in terms of applied research opportunities outside of campus, I'm involved in 2 suicide prevention initiatives. One is called PC Cares, which is promoting community conversations about research to end suicide, which is really working in the Northwest Arctic here in Alaska. And the second is called Anchor, which is the Alaska Native collaborative hub for research on resilience. And there's an embedded research study in that as well. And then I suppose I should mention just before I close here is that The classes I typically teach now, I teach 605, which is Public Health and Society, kind of the social and behavioral basis of public health. Dr. Nix and I alternate that class. I also teach HS 615, which is our Health Administration and Policy class, and Dr. Miller and I alternate that class. And I teach HS 624, the Circumpolar Health Issues class, and that I alternate teaching with Dr. Anstaslavsky. And I'm currently and have been pretty active in circumpolar health issues, and am the current editor-in-chief of the International Journal of Circumpolar Health. And so if you're interested in publications or manuscripts or being a reviewer, we're always looking for those opportunities as well. So I'm happy to be here and appreciate the SAC and Gabe for putting together this first kind of orientation for students. So thanks.
Thanks, Dr. Johnson. And then Dr. Miller, you can answer the
Questions number 1, right?
Yeah.
So I'm so glad to be here. The focus of my work has been for a long time maternal and child health, and primarily surrounding issues of access to services for low-income women and their children. And to that end, I'm fortunate enough to sit on several groups that work with the Division of Public Health, specifically in the section of women's, children's, and family health. One of those is the Advisory Steering Committee for the PRAMS program, which is a large program funded by the CDC. It stands for Pregnancy Risk Assessment and Monitoring System. And I have the opportunity to look at, there's a standard set of core questions and then Alaska specific questions. And I'm real lucky to have an opportunity to have input into that. Similarly, another group that I participate in is the Children and Youth with Special Healthcare Needs. And this steering committee really is in partnership with the program through the section of women's, children's, and family health, looking at broadly services for kiddos that need special services across Alaska. And then in other community engagement, just briefly, I am fortunate to serve as a training director for the Alaska LEN program, which is administered out of the Center for Human Development. And as an interdisciplinary program, we are all over community engagement. And I'd love to talk more about that, but I would invite you, if you have specific questions, let's set up a personal conversation.
Okay, great, thank you. All right, second question. What are the most common stumbling blocks students encounter? Do you have any advice to avoid these? We'll start with Dr. Garcia.